And here with more plus answers to your medical questions is Dr. Msonthi Levine. So if you have a heart attack, then you should get after it, doctor?
Absolutely. I mean, there's a lot to talk about after you have a heart attack and bypass surgery. You normally go home on 3 or 4 new medications. There's a lot of conversation about changing your diet. So a lot of conversation. This is just an added conversation, actually, and one that is important because, as I mentioned, sexual activity is a physical act, can stress your heart out, increase your blood pressure and your heart rate. So if you're not ready for it, certainly don't do it. And probably just work with your individual physician to determine the right time to re-engage in that type of activity. It might include a stress test prior to that, although that's not common if they don't have symptoms, but just have a conversation with your physician.
Something else you probably want to talk to your physician about is those added medications. There may also be a side effect when you're talking about intimacy with your partner.
Absolutely. A lot of times heart medicines or blood pressure medicines and vice versa, and basically they lower your blood pressure, they prevent your heart rate from going up. You need all that, unfortunately, with sexually intercourse, so absolutely can induce some erectile dysfunction, and certainly in concert with your physician, you might be a candidate for some erectile dysfunction medication such as Viagra or Cialis, but certainly in conversation with your treating physician. It is a major problem, unfortunately, and sometimes guys will stop taking the medication. Such a bad idea, because it will just continue to cause end organ damage with your heart, your kidneys, your brain, and eventually you have to get back on the medication. So please don't make that mistake. Get on your blood pressure medications, get your exercise, your lifestyle, etc.
All right, on to some of our viewers' medical questions. This person wants to know, if it itches, should I scratch it?
I think sometimes you can, but certainly if you continue to scratch it, you can cause secondary bacterial infection and a lot of trauma to your skin, which is unsightly. So try not to scratch continually. Maybe try an over-the-counter hydrocortisone cream. Certainly if it doesn't go away, get to your physician for a good workout.
Okay, another question. Can infections in people's body make them lose memory, short or long term?
I think so, especially the severe infections, which we call sepsis, which is a medical term, which means severe infection. It gets inside your bloodstream and can go to your brain, and certainly if you're vulnerable, like an elderly patient, certainly it can cause some short-term problems and long-term memory problems as well, so absolutely.
Can codeine cause people to act abnormal or even lose memories?
Big time. You know, it's a very powerful pain medication. Unfortunately, we do have some issues of misuse and overuse in this community. We're trying to work very hard to help patients deal with that. We know chronic pain is a big issue, and we want to treat it accordingly, but you have to be very careful. Codeine is a big time issue, so just work with your physician.
Okay. What are the options for adults with high-grade scoliosis? I
think anytime you say high grade, it means it's severe, and medicines normally don't work. Certainly therapy can be tried, injections, but a lot of times you just need surgery. With a good back surgeon. Certainly chronic pain, severe pain, neurological symptoms are indications for surgery.
Okay, and we've got lots of other questions. We'll get to those in just a minute, so don't go away. Dr. Levine will answer more of your questions next on Live at 5. We're back with Dr. Msonthi Levine to answer more of your medical questions. This person says the back of their scalp is itchy with hair not growing. What could it be?
It sounds like it may be a dermatitis or an immunological reaction of the scalp, such that the immune system is attacking the hair follicles in the scalp. A lot of times the dermatologist will inject steroids into the area that's affected. Also, topical steroids work really well. I wouldn't let that go, because the more damage that's done, the follicles don't come back, and
you may not have hair right there.
That's right. You'll need a hair transplant or something like that.
Okay. Another question. What are your thoughts on the HCG diet?
You know, I'm not a big fan of those type of diets. I say all the time on this show and on the radio show, you just got to stick to the basics. There are no secrets out there. It's not a mystery. Vegetables, fruit, whole grains, lean meat, it's never going to go anywhere. Don't trick yourself.
Exercise.
Exercise, you can't get away from it. I think some people, maybe they don't like vegetables, maybe they don't like fruit, and they're looking for an alternative, which is fine to a certain degree, but you can't get away from the basics.
Okay, another question. This woman has pain in her right side, very similar to gallbladder pain, but she no longer has a gallbladder. What could it be?
There's a lot of things in the abdomen. It could be her kidneys, could be her intestine, pancreas, stomach. So a lot of times we'll do a CAT scan, or an upper endoscopy performed by gastroenterologists to make sure. I know a lot of females have a lot of idiopathic abdominal pain, but certainly she deserves an evaluation, make sure nothing's going on.
59-year-old female, she's never had chicken pox. Could she get shingles from taking the shingles vaccine?
Not to my understanding, and a lot of times you don't necessarily have to have the chicken pox reaction or infection to get shingles. We kind of become infected with that virus the longer we're alive. So all people as they reach 60 deserve that immunization because the risk of the shingles flare is there. But as far as I know, it does not give you the shingles. For some people, we don't like them to get it, patients who are on immunosuppressants or who have immunocompromised state.
Okay. This person, their back hurts when walking but fine when sitting. What could be done?
Well, a lot of times that could be certainly circulation issues. It could be just degenerative joint disease of the back, spinal stenosis. A lot of times we look at x-rays, MRIs, and a lot of times we can get away with epidural injections and sometimes anti-inflammatory medications.
Okay. This person's been sick for the past week. Severe headache, stomach issues, ringing in the ears, and dizziness. Their lower back also hurts. They've had elevated enzymes in the liver in the past. What could this possibly be?
That could be a number of things, but this person sounds pretty sick. They've been sick for a week. I think they need a proper evaluation. They need to be hospitalized, especially when your liver enzymes go up.
Yikes.
That means it's something systemic. It could be viral hepatitis. It could be sepsis. So this is kind of a sick person. I would certainly seek immediate medical care and get a proper diagnosis.
Okay. Back to our Facebook. What are the options for adults with, we've already read that, the high scoliosis. I get unexplained small dark bruises on my legs. For me, it started very shortly after I had my last child, which was by C-section. Like my firstborn. What could be causing the bruises?
There's so much that goes on hormonally when you have a pregnancy, including your hematological blood system, also swelling in your legs, the circulation changes, probably just from pregnancy. It should go away, certainly if it doesn't get a full workup.
Okay. Why is lupus so hard to diagnose, and when doctors don't know what's wrong, why do they always say it's fibromyalgia?
Because sometimes it's very elusive. That is a very problematic issue with rheumatological illnesses. Stick with your doctor. Keep getting evaluated.
All right, Dr. Levine, as always, we appreciate you stopping by, and you can always visit our website and see the answers to these and other medical questions posted online. And if you'd like to have Dr. Levine answer your medical question, you can always mail us at the address listed on your screen. You can fax us 892-7305, email us at laf@kftm.com, or you can post those questions on our KFDM News Facebook page every Monday.